Okay, good afternoon, everyone.
Good afternoon.
Afternoon.
Good afternoon.
Okay, so
Mm.
I'm actually not leading this. This is going to be led by our student health and wellness folks. So whoever would like to, well, actually, I guess I am because I got the slides. So, okay, here we go. Welcome to our World AIDS Day. Thank you for joining us to honor those individuals who have been affected by HIV/AIDS. We have a great program prepared for you today, so we'll go ahead and just get started.
Okay. Hi, everyone.
Oh, the introductions will be coming, Nurse Arnita. Here we
Oh,
go.
sorry, Miss Danielle.
That's all right.
All right. I'll wait my turn.
So with this World AIDS Day, Nurse Ann, do you want to read the theme since you found it?
Sure, I'd be happy to. The theme for this World's AIDS Day is Ending the Epidemic, Equitable Access, Everyone's Voice.
All right. So before we get started, we want to, as I said in the beginning, honor individuals. So we'd like to take a moment of silence to honor those individuals who are not only suffering with this disease, but also have succumbed to it. We know that over 700,000 people are diagnosed with this disease on a yearly basis. And so this moment of silence will encompass all of those individuals as well. So if you will join me. Okay, thank you. So as we progress, we're going to be, as you see our agenda here, we'll have some introductions. Nurse Arnita actually already started that, so we'll let her pick it back up and finish for us. We also have a Kahoot game to kind of test your knowledge about different facts about HIV and AIDS. Throughout this program, there will be discussion. And finally, we will end it with some resources to offer you about testing in the community and take any questions that you may have.
Okay. So I will go again. My name is Arnita Shelton, and I am the campus nurse here at Prince George's Community College. And I also just want to mention that I retired from Prince George's Hospital Center. And I'm mentioning that because later on as we speak, I have taken care of numerous HIV positive patients. So as we talk, I'll be able to share some of my experiences with that. So thank you and get ready for a great program.
Excellent. Thank you, Nurse Arnita. Nurse Ann?
Hello, I will introduce myself. I am also one of the nurses at the Wellness Center, and I too have taken care of many patients with HIV as well as AIDS, particularly in the very beginning when it was first identified, which was in the really early 80s to mid 80s. And treatment has advanced incredibly well. And I'm happy to be here.
Excellent. Thank you, Nurse Ann. We also have one of our mental health counselors joining us today, Mr. Ken.
Yes, good afternoon, good day, everyone. My name is Devel Kent. As mentioned, I am one of the mental health counselors with the Wellness Center, and I'm just elated to be here to hear the knowledge and insight that's going to be given around such a very sensitive and impactful topic. So thank you all. Welcome, welcome.
Excellent. Thank you, Deval. And I'm your moderator, Dr. Danielle Bryant, and I'm also one of the mental health counselors in the Wellness Center. Okay. So that takes care of our introductions. We will go ahead and I invite you all, I'm going to stop sharing my screen here, but in doing so, I want to invite you all to if you have your phones or computers handy or tablets, please go to kahoot.it. That's KAHOOT.IT. And we will use that to get started to play our game. Let's see. There we go. And there's our Kahoot game. Wonderful. Okay. All righty. So here we are. So as I said, if you would go to www.kahoot.it, we welcome you to play. So I will give this a few minutes so that, yeah, about 1 minute for you all to get signed on. Okay, I will sign on to www.it. All right, the dude is in. Cool.
The dude.
The dude. Game pin 486-6064. And my nickname. Who else is in there? Oh, Chantal is in there. Okay. Okay, got 3 folks. Anybody else before we give it a whirl? Okay. So we'll go ahead and get started. Even if you haven't signed on here, feel free to play along. If you know the answers, that's fine too, because we'll be coming back to discuss those answers and give a little bit more information to kind of fill it out. So let's go ahead and get started. It should be. All right, we got a true or false. According to the CDC, more than 700,000 American lives have been lost to HIV since 1981. Okay. So it looks like that is true. All right. Is that something you can speak to, Nurse Ann?
Yes. So our statistic does come from the CDC, and in terms of the 700,000 American lives have been lost to HIV since 1981. More than 1.1 million Americans are currently living with HIV, and many more are at risk of HIV infection. While new HIV diagnoses are declining significantly from their peak, progress on further reducing them has stalled with an estimate of 38,000 Americans being newly diagnosed each year. So we certainly continue to have new diagnoses,
Mhm.
and that's one of the reasons for having World AIDS Day, and getting some more information to
Okay.
people.
Excellent. All righty. Let's take the next question. What is the symbol for World AIDS Day? Okay, and it looks like the red ribbon is it. Who would like to speak to that? Is that Nurse Ann or Nurse Arnita? Or do we need to speak to?
I'll say something.
Okay, thank you.
I remember when I worked in the hospital, and well, you know what, let's go back on that. I retired from there 3 years ago, and World AIDS Day has not been a day too long. It's not like one of the days that we've had for years and years and years. So, it's been made, and that's a great thing. So we
Mhm.
all wore red that day, just like it was Red Heart Day for,
Mhm.
cancer. We would wear red and have our red ribbon. So that was just a way that was recognized. And a lot of people would say, what's that for? Because like I said, it wasn't a day that it
Mhm.
was recognized by a lot of people. So that was our chance to, to say it's for HIV, AIDS Day.
Yes.
So it was a good way to let them know what it was for.
Okay, excellent. Thank you. All right, let's go to the third question. What does HIV stand for? Okay, it stands for the human immunodeficiency virus. That is so HIV is actually the acronym for human immunodeficiency virus. Immunodeficiency meaning that you don't, that your immune system does not work well or is deficient in some way.
I could probably speak on that in relationship
go
to
right
the
ahead.
fact. Oh, thank you. In relationship on the fact that we do have many new medications, many better ways in which to identify HIV through testing, which is readily available, as we'll see in our resources, as well as the fact that now the form of taking medication that would be antiretroviral therapy is in tablet form. And that's a good thing, because as we have this new evidence and guideline change, the guidelines of when to begin treatment has also changed, which has allowed the patient to start treatment at the time of the diagnosis. It had been based on what some of their cell count was for deficiency, but now they really believe, and of course that's been done through research, that early initiative of this art shortens the time between the diagnosis and viral suppression, lowers the risk of transmission sooner, and improves the retention in care. And again, with our CDC reference, according to Cynthia Rivera, MD, my main goal is to get started as soon as possible and maintain whatever immune system function we have. Maintain that, perhaps build it, and get our viral load as low as possible, as fast as possible. The goal is to get completely virologically suppressed. So really, again, we have just an incredible opportunity for treatment. And we certainly want to encourage people to get tested as well as treated.
Excellent. Well said. Okay, let's go to the next question. Thank you, Nurse Ann. Uh-oh, the dude has a streak with 3 in a row.
Oh,
Uh-oh.
Oh,
shucks.
suck it.
The
All
dude.
right. Number
That's
4,
right.
having HIV can be a major source of stress, true or false? Okay, and that one would be true.
Mhm.
I can speak to that a bit because that's kind of in the realm of mental health. And in doing some research for this, there seems to be some belief that situations can contribute to mental health problems for people living with HIV. And the reason why the different types of situations can include having trouble getting mental health services, experiencing a loss of support like social support, and that can cause isolation, which we know isolation and loneliness can be a mental health trigger. Uh, Individuals living with HIV also can experience a loss of employment or worrying about how they'll be able to perform at work. They may have stress around having to disclose their diagnosis to people. Stress may occur around having to manage the different types of medications. Nurse Ann did talk about one of the medications is now in a pill form, which makes the administration of it much, much easier. Other causes of stress could be dealing with loss, including the loss of relationships or even the death of friends and loved ones who may also have the disease. And finally, stress around facing the stigma and discrimination that can be associated with HIV and AIDS. So yes, it can be a major source of stress.
I wanted to speak just a little bit about the medication part. That's a part that I had to deal with a lot. And now, thank God, they're down from like, oh wow, I would give a person maybe 10 pills. And now they're basically down to 1 or 2. But the problem would be them being able to hold it down. Like they would take 10 huge pills, not no little baby aspirin size pills, huge pills. Their appetite is not the best. So they would take like 6 huge pills with nothing to eat, and then they would throw it up. So that of course is not good. So now they Truvada is one of the ones that they were using when I left the hospital, which is 1, and Comboville, which is 1. So now they're like down from 6 to 1. And that was one of the most important things because they are so expensive. So the expense of the medication right there would be a stressful one. So being able to just take the medicine and even being able to get it, that right there is stress number 101.
Okay. Okay. Very good. Thank you, Nurse Anita. Excellent. All right, now not to be outdone, Chantal has a streak with 4 in a row. Oh, wow, wow.
Oh.
All right, let's see the next question. Number 5. AIDS stands for what?
Excuse me.
Okay, looks like everybody, or as the some kids like to say, everybody got this one right. So that's fantastic. Acquired, meaning that it's something that you catch or you get. Nurse Ann talked about the immunodeficiency piece, and the fact that it's a syndrome means that, well, I'll let the nurses explain. I think I know what it means, but the fact that it's a syndrome, what does that mean for one of our nurses, please?
I would say that it's treated over time,
Mhm.
and and it can have different manifestations,
Yes.
meaning that, you can have, as we said, with these amount of T cells and the different type of load that these viruses carry. You can have ebbs and flow in that. Again, that's the importance still, again, of testing. And it is suggested that people get tested seasonally. That's how you can remember. So if you are negative for HIV, you could still, get tested 4 times a year, remembering our 4 seasons.
Okay. Very nice. Thank you. Oh, tall. Nose hurts up. Okay. All right. Number 6. So, okay. This is asking about percentages for specific Black Americans. What percentage? Okay, so it looks like 41% is the answer, which this is pretty significant for a population of individuals who only make up 13%. They also almost make up half of HIV cases, which means that there's a lot of work to be done within that community around education, prevention, and treatment. Would you all agree?
Absolutely.
Yes. Yes. Yes.
Okay. Emphatic yeses. Okay. All right. Oh man, the dude. Okay, dude. All right. Let's go with the next question. Number 7. What is the theme for World AIDS Day? All right, this one was a gimme. Even I got that one right. It's a gimme. Okay, yes. As Nurse Ann pointed out for us, ending the HIV epidemic, equitable access, everyone's voices, meaning that we want individuals who have been diagnosed with this disease to be able to access different types of services, whether those services are mental health or whether those services are medical services, pharmaceutical therapy, anything that is going to make it easier for them to be able to deal with this particular disease. And then everyone's voices, meaning that people need to be heard in terms of what is it that they need, what is it that they can do for prevention or for support. We really need everyone at the table here if we're going to eradicate this disease. Does anyone want to add anything to that?
Just to say that the theme does change yearly.
Okay.
And I think this speaks to, again, much of what we've learned through the knowledge of how COVID affects people too. Even though this is not COVID, I think there's been more emphasis on equitable access
Yes.
of care, and I think that's something that can be beneficial to public health and the spread of disease.
Yes, yes. Overall, and especially in communities of color. All right. Oh, it's neck and neck here. All right. 8. People who are living with AIDS are at greater risk for mental health issues. True or false? Okay, very good. And that would be a true. So I'll speak to that a little bit in terms of the different types of mental health issues that may arise. It was very interesting in finding some background data for this presentation, because I was able to come across some world statistics. This is World AIDS Day. So how are individuals in other countries having to deal with their mental health as it relates to having an HIV or AIDS diagnosis? And some of the things that that have been found in the literature include, in Canada, for example, people living with AIDS, people living with HIV had a 41% higher chance of having mental health issues than people who did not. People who did not, it was compared to 41% versus 22%. So it's almost double in Canada, people living with HIV. In another study with people living with HIV in India, it showed that 59% had signs of major depression. That's a pretty high number. Over half of individuals in India. In China, a recent review found prevalence of depressive symptoms in 61% of people living with HIV. In Uganda, major depression was found in 14% of people living with HIV. In South Africa, they actually had a range that 26 to 38% of people who have HIV are at risk for having a mental disorder. And then finally, within the United States, there was a study of about 2,800 people who were living with HIV, and 36% had major depression. 15% had anxiety, general anxiety disorder as well. So what these statistics tell us is that, yes, mental health is significantly impacted by a diagnosis of HIV and having the AIDS virus as well. Any other comments on that piece before we go to the next question?
I was watching a Tamron Hall, and I think his name is Portis. I forgot his name. I think it was Portis. He's a designer. He came out on the show that well, everyone knew that he was gay, but he came out on the show that he had HIV and had it for like 20 something years. And as soon as he said it, you could see his face. I mean, he looked like a different person within the 5 minutes of him coming out saying, and that nobody knew. Not even, he said, yeah, except for him and his partner. So his mother found out, his family found out. And he said that was the only way that he could do it, was to do it on national TV. So that's a serious secret. And I'm sure a lot of people have done that. They keep that secret to themselves because they don't want to tell anyone else.
Thank you, Nurse Arnita. That's a good point in terms of identifying the stigma that can be associated with this particular disease. Anyone else have any comment before we move to the last question?
Well, I guess that I also noticed the high percentage in China, 61%.
Yes.
And I would have an educated guess that part of that would be because of how closed the country is in terms of communication, in terms of perhaps even their ability to, as Arnita pointed out, to share information. It might not be as possible in China. And again, that's certainly nothing I've read about, but
right.
It makes me kind of think that way. Or
That's a good,
speculate. Let's put it.
yeah, speculate. Yeah, sure, Nurse Ann.
Uh-huh.
Because what you're doing is you're introducing the idea that culture can have an impact on access and education.
Mhm.
Okay, oh boy, it is neck and neck. So I guess this last question will determine who is top on the podium. Let's go. Last question, true or false? World AIDS Day was first celebrated in 1988. Oh no, I don't think I'm gonna make it in time. Nope, didn't make it in time. All righty. And it looks like our folks both got it right. Oh boy. Okay. Before we go to the scoreboard, is there anyone who would like to speak to this idea that it was first celebrated in 1988? So how many years does that give us? 32, 33, 33 years that we, go ahead, please.
Well, I was just going to say, I think part of that is because it wasn't recognized to begin with when it first, presented itself in the medical community.
Mhm.
People didn't know exactly what it was. As I said, that was, in my experience, like in the early 80s. And I'm sure it was evident before then, but I think they even knew less. So it's possible that for the world, to really acknowledge it and be able to speak to, as you said, the ability that different cultures, different countries would have to actually acknowledge and recognize that this is something that affects everyone in the world. It could be that's why it took that amount of time. Identification of the actual syndrome and spreading of information. That's just, again, my educated guess.
Yeah. Okay. Yeah, and let's not forget, the stigma that was associated with this disease when it first came out. The fact that it was labeled as a disease just for individuals who were labeled as homosexual. And they didn't even use the phrase gay. You were homosexual. And the way in which it was talked about in terms of transmission. So I think over time, we've had to soften our stance because we found out it's not just people who are having unprotected sex. It's not just people who are sharing needles for drug use, intravenous drug use, that it can be passed from mother to baby through breast milk as a way of transmission as well. So the idea that we're understanding this disease, gaining more knowledge, and being able to make better choices for our safety has really happened over time, as has this development of acknowledging World AIDS Day.
And then on that, no, Danielle, about the, when we're talking about the spreading, I remember when I used to work labor and delivery and the mother would be HIV positive, we would actually treat the baby because there would be really no way to find out 2 days if the baby was HIV or not. So we would actually treat the baby. And another thing, back in the day, and I'm not really sure how they do it now because I don't work in the hospital anymore, but we as nurses were not allowed to tell like the baby's father that she was HIV. It would have to be the doctor's responsibility. So, I mean, we had to do, I remember we did all kind of things So we was, because we would have to give the baby the medicine. We couldn't keep the medicine in the baby's bassinet. We would have to lock it up because somebody might look in there and they say, "Oh, what's this? What is AZT? What's that for?" So we had to be very careful of how it was found out. It was doctor to patient, wasn't nurse to nobody. And then then another thing we can talk about, I don't know if you was gonna bring this up, Danielle, was how the transmission.
Go right ahead, Nurse Arnita.
Yeah, I remember in the hospital, and before we really found out a lot about HIV, we would think that you would get it from the toilet stool. That was the most thing that I would always think about. The people would say, don't sit on the toilet stool. They would have wads of paper on the toilet stool because somebody sat on it, regardless if they knew it or not. Or not sharing forks and spoons and stuff like that. So we really had to find out how was it transmitted, because people were just making up things. So, and even with the baby, the mother couldn't breastfeed the baby if she was known to be HIV, because that's a way of transmission also. So it took a lot of research, a lot of learning, because we didn't know. And then the doctors didn't know. This was like almost like COVID. It just kind of popped up. So we had to do our homework to find out, how to treat it and what to do.
Yes. Okay, good points. Thank you so much. Okay, let's see. Here's podium time. Number 3, moi, that's me. Ho ho. Number 2, Chantal. Uh-oh, that means the dude.
The dude. Oh, wow.
Can you come off mute, dude, and take your accolade?
Give it up for the dude.
Oh, wow.
Excellent. Okay, very good.
Wow.
Very good. Thank you so much for playing our game. I think we were able to not only have a little bit of fun, but also learn some information.
Absolutely.
About, come on, there you go, about the AIDS program. Okay, or excuse me, not AIDS program, about the HIV and AIDS. So right now, we'd like to take a look at a video that we have that's called Stop the Virus. And once we finish the video, then we'll come back and discuss what we've seen. So let me find that for you. There it is. Okay. Video is right. Let me share it so that you all can see it. Share this one. All right.
The average baseball stadium holds about 50,000 people, enough to fill a dance floor the size of a New York City block, or float down a river 53 miles long. It was also the number of people in the US who became HIV positive every year since 2003. Then, something happened. One by one, we said, enough is enough. Instead of waiting for a cure, we took action. We got tested and retested. We talked to each other, and we talked to healthcare providers about HIV prevention medicines and safer sex practices. We talked about STIs, condoms, and all the ways to help prevent infection. People living with HIV started treatment right away and stuck to it, which can prevent the spread of HIV through sex. And it worked. New infections went down, but we still have work to do. So let's all do our part and keep fighting. Because together, we can all help stop the virus. Find out what you can do at helpstopthevirus.com.
Okay. Thank you, Nurse Ann, for providing that video for us.
You're welcome.
Appreciated you finding that. Any comments on what we just saw in terms of the video for stopping the virus?
You know, the one thing that I think about immediately is just looking at the progression of how prevention methodologies, treatment has advanced significantly. But it really relies on individuals to communicate, inform, and make sure that they test. And I think that because of the stigma with the condition and the negative connotation associated with this, it's easy for individuals to psychologically say to themselves, out of sight, out of mind. If I don't test, I don't know, I won't have to deal with it. Or be in disbelief about how it can be contracted. So, you know, education and information is paramount. You know, some individuals probably don't know the ways that it's contracted. They may know maybe one or two of the ways, or they may know 90%, but maybe forgetting one way or not knowing one way. So, you know, how we've advanced is amazing, but we still have to be more proactive in the community. And it's up to us individually to educate and inform us collectively.
Okay, well said, DeVal. Thank you so much for that comment and that perspective, actually. So yeah, definitely well said. Anyone else have any comments?
Well, I do know that they have they are doing a great job with spreading the word, because they have a zillion commercials, all kind of ways, you know, at the picnic, you know, they're just doing a good way of spreading that, you know, that you can live with it, take your medicine, you know, do what you need to do, and you can have a productive life.
Yes, I hear you, Nurse Anita. Yes, the commercials do kind of put that out there, that better living through medication. So yes. Okay. So as we begin to wind down, if there are any further comments, feel free to make those before we head to our testing and resources. That's the last piece that we'll do.
Well, I did want to mention, because there is question about COVID-19 and people with HIV,
Okay.
the CDC has said that whether people with HIV are at greater risk of acquiring COVID is currently unknown. And as we have even presented statistics, they're coming from like, 1918, 1919. It takes a long time, as we have also experienced with the information that we find out about COVID, that it may take many years before they can actually see a relationship in terms of a greater risk. But what is recommended is that everyone follow the things that we have been doing in relationship to COVID, vaccination, social distancing, masks, education, information, talking to your doctor, and again, the experience that the local health departments and state will have in relationship to the spread of the spread of COVID. However, what they find in the general populations is the individual who is at high risk for severe COVID includes people who have comorbidities. And this is where it's mentioned that many people with HIV have one or more comorbidities that might increase their risk for severe course of the COVID. And when we mention the comorbidities, we are talking about other diseases and illnesses, and also the immune status, yes, and the advancement of HIV. Those are factors that would also be included. And comorbidities can be anything from cardiovascular disease, obesity, diabetes, pulmonary disease, smoking history, sickle cell disease, multiple comorbidities that we see. So the recommendation is, as we said, the same in terms of vaccination, but also there certainly might be additional vaccinations for COVID and or boosters. So again, keeping informed and checking with your doctor, in addition to other types of immunizations, such as the immunization for flu, which I believe too, that has come out very strongly for everyone in, well, at least the last 2 months. And it is encouraged to, in addition to having the COVID vaccination, to have flu vaccination.
All right, excellent. Thank you, Nurse Ann. So what we'd like to do now is to present the different testing resources that are available in the community. Nurse Arnita, I know that this was an area that where you had done some research. So definitely would like to let you talk to this slide, if you will.
Okay. Yes, the first one, Heart to Hand, I actually spoke to Conchita. She is the manager, and she called that number if you would like to, and they can come to you. At one point, they were coming to the client to do the test. This is with COVID. She said that they're starting to open the office back up now, but they were at one time coming to you to do the test. And they also, before COVID, we were doing testing here in the Wellness Center. I think it was like once, Ann helped me out with the memory. I think it was once a week we would do different agencies, but I know Heart to Hand did come. The students would come here in the Wellness Center, get the test done and get the results done. Of course, confidentiality.
Yes.
So that was, of course, that was done. I know we're gonna try to, in the future, when everything we claim and open back up and get back to normal, we claiming that too, that we'll be doing it again. But we were doing HIV, STI testing right here in the Wellness Center. Greater Baden is right, what's that, over off of Addison Road. And they also do it there in the office. Now, PG Hospital, it says PG Health Department, they are still open. I literally had to call all of these places because a lot of places are still closed and a lot of offices are done by appointment. So before you just go just go to the building, I will call and see how their services are offered. And PG Hospital now has a new, what's the name? I don't remember the name. That's the hospital I worked at forever. I'm used to PG Hospital, but now they have a new hospital, the one over over by the boulevard. But I'm sure that they have a HIV clinic somewhere there in the hospital. But they're still doing testing. It's always confidential. You know, you can call the number and find out when you can come. But it's still being done and they're still quite busy, especially with COVID. Just like we having a baby boom right now. I don't know if you all noticing, a lot of people. But I'm sure AIDS might be on the rise. Like a lot of, I've also heard the STIs, the syphilis, the gonorrhea, that too is on the rise again. So we still have to be careful.
Okay. So the crux of the matter is understanding how living with HIV and AIDS can affect mental health, and knowing what resources are available can really make it easier for people to manage their overall health and well-being.
Mhm. Yes.
Okay. All right. Well, that will conclude our, at least the information that we have for our program today. Are there any lingering words from our panelists?
I think I was talking to you, Danielle, about when I did work in the hospital and I would take care of patients. It came to my mind as a lonely, it's a disease, a lonely disease, because a lot of people, they didn't understand it. Just put it like that. That's a good way to put it. They didn't understand what HIV was, how you could catch it. So nobody would want to be around you. Nobody would want to come visit you. The nurses, even at that time, didn't even want to take care of you because we didn't understand. But now that we understand more, you know, we have people HIV that work with us. They're our cousins, they're our sisters, brothers. So as long as we understand it and have the correct understanding of it, not just making up stuff, then I think that helps it a lot. So I'm glad we do understand it more than we did.
Okay, all right. Okay, well, thank you, Nurse Arnita. Thank you, Nurse Ann. Chantal, appreciated your participation. Thank you so much, Mr. DeVelkent, for your participation and for winning the game as well.
The dude.
Yes.
Oh, wow.
Yes. So at this point, we will conclude our program for today, our program to honor World AIDS Day. We do this every December 1 in our effort, and we had our moment of silence earlier. So we'll go ahead and close our program at this time. Thank you all for attending and participating. And certainly contact us if you have any additional questions in terms of how we might be able to help or refer you to additional resources around this topic.
Okay.
Thank you.
Thank you.
Bye-bye. Thank you.
All right, everyone, have a wonderful day. Great information today. Thank you so much.
Thank you.
Thank you.